very warm welcome to a special edition of your favorite program, Health Affair, where we discuss critical health challenges with a view to finding lasting solutions. I call it a special edition because we'll be focusing mainly on the sector review for the year 2020. I am your host, Oshomowa Daniels. Let's begin with our news segment.
Issuance of fake COVID-19 results without tests in Nigeria greeted relevant authorities with shock, and that necessitated investigation that led to the apprehension of 2 suspects by officials at Isolo.
The suspects by names Enoch Basian and Vasin Binra were caught in the act while they were trying to do COVID-19 tests for one of our staff who acted as a dummy patient at the front of a bank at Isolo. Because of their confessional statements, the suspects revealed that they sometime came to our institute and surreptitiously took away our COVID-19 testing request form under the guise of coming for COVID-19 tests. Upon interrogating our staff, who is in charge of the testing request form, he admitted that he had once mistakenly given out a blank form to some individuals who made away with the same without trace. This mistake he attributed to work pressure. Armed with our request form, the suspects collect samples and fabricate results which they issue to people with or without undergoing testing.
To check such loopholes created by the development, the Director General of Nigeria Institute of Medical Research, Babatunde Salako, said photo identification will now be required, along with an invitation letter for people to be admitted for testing.
To stay healthy and productive in the new year, people must take their health serious. This call is coming from health experts at a recent community outreach in Lagos.
We are trying to achieve a healthy community. Like last year, we lost a member. We gave just a minute silence for one of the community women. It was in this gathering we realized she's hypertensive. But I have issues with a lot of them that when you identify and refer them, they don't take their medication. She just went to Sweep Church right in there. She slumped and died. You understand? We've had so many of insight. We've helped them to have insight into their mental health, into their physical health. And that is our joy.
A privilege to meet a medical personnel for free, and also feel free to express yourself, your health status, and at least counseling also.
Something very good and something very beneficial to the community, because these days many people neglect their health, their mental health. Most people don't know if they are overweight, underweight. They just keep eating, they keep doing things that are harmful to their body, and they're not aware of it, especially in this rural community. So I think this is very good because it's opening a lot of people's eyes.
To help reduce the spread of the new variant of the COVID-19 pandemic, they also called for strict adherence to the preventive guidelines.
Like this period when there is coronavirus, we find out that people are not even using face masks. They don't know the implication of lifestyle illness and the effect on coronavirus. COVID-19 is real. I am a medical practitioner, so I know what is trending in town. And I stand this opportunity to counsel and advise people to obey the stated rules, not to be a victim.
22-year-old Michael Gui Wang, an activist through his passion for scientific and technological solutions for Africa's advancement. He has turned around the health and agricultural sectors in his nation, Cameroon, thereby saving thousands of lives during the COVID-19 lockdown.
We produce a platform to network blood donors and recipients. We produce an agricultural device to aid farmers to be able to produce flour from various plants. We actually have produced other machines, some to aid blind people. Is that we shouldn't relent our efforts as far as change is concerned.
Believe in your future, believe in your dreams. Once you can dream it, once you can see it, you can achieve it.
One of them had a very moving story. She took off her pursery what she was giving to enable her to go to school. Because of the lockdown, school was not in session. She converted the funds and was using it to provide food for people who were hungry. Amazing. And what we take from here is we can't allow the circumstances around us and situations to hold us down.
It's not enough for us to import technologies from abroad. They may not work here. We know the climate, we know the maintenance culture. So we want to encourage homegrown technological intervention.
Michael and his 9 other colleagues who made the top 10 list of the 2020 African Future Leaders Award believes that there is a lot governments in Africa can achieve through technology.
Thing which we've seen as a result of COVID-19 is that our health systems have failed us, and African governments should see how they can harness the power of technology to bring about better and safer healthcare delivery.
I find it very funny that a youth wants to help the community, but those leaders who are in position are against it. And you wonder why. You are supposed to be empowering us, but you find that most African leaders are pushing down their youth.
Welcome back. The year 2020 will not be forgotten with the COVID-19 pandemic outbreak that shook the world and disrupted global economies. Though many say the pandemic caught Nigerians unaware and further exposed the challenges in the health sector, it was not as bad as predicted by international watchers. All these and many more challenges in the sector is what our commentary centers on today. Please take a listen.
Like every other year, 2020 began with great expectations for individuals, organizations, and nations. These expectations were short-lived with the spread of the COVID-19 from Wuhan in China to other countries of the world, including Nigeria. The Italian index case that came through Lagos to Ogun State survived the infection, but not without consequences, as that singular index case caused deaths and brought grief to several families across the country, with footprints of continued spread of COVID-19 among Nigerians still being recorded daily.
The outbreak is expanding, so we expect to see more cases. We have not reached our peak yet. You would imagine that as we diagnose more cases, that our bed capacity will increase. Indeed, that's happening.
To curb the spread of the infection and enforce adherence to preventive guidelines, a lockdown was ordered by the federal government in March 2020.
During the lockdown period, a lot of people could not access their tablet for hypertension. They could not access their insulin or their drugs to treat their diabetes, and that was why most of them died.
The lockdown was wrongly planned. The lockdown never worked with what we've seen thereafter, because the lockdown gave room for more problems than even the COVID for which the lockdown was instituted. So, I mean, we began to see cases of domestic violence and rape issues, violence against women, got on the rise. So clearly one thing we get from it is that the lockdown was never a solution, was unscientific, it's been proven, and we do hope that we don't make that mistake again. What we must now do is to increase the education. It must become an integral part of our education, and awareness campaign must be carried out under whatever circumstance. No man has a reason whatsoever to lift a hand against a woman, not even sexual, to sexually assault a woman. It is wrong, it's ungodly, it is condemnable.
With the death of notable Nigerians like former Chief of Staff to President Buhari, Abba Kyari, Buruji Kashiamu, a former senator in Nigeria's National Assembly, former governor of Oyo State, Abiola Ajimobi, and several others, one would have expected Nigerians to take responsibility for their health. But this wasn't the case, especially with the coming of the second wave of COVID-19 that spreads even faster and more deadly.
So far, we've identified a handful of variants, or what we call mutations, as you've heard in the United Kingdom, in South Africa, and even here in Nigeria, we've identified mutants. So It's not unexpected. It's a natural phenomenon. All viruses mutate. The flu virus mutates every year. That's why you need a different vaccination every year for the flu. But there is very little evidence that these mutated coronaviruses, Corona-19 viruses, are behaving in any way very different from the parent. So the mutation hasn't caused a major shift in the way the virus is behaving. There is a suggestion that it is slightly more contagious in the UK scenario, but we haven't observed that here. And we certainly haven't observed that the virus is more dangerous.
Everybody's at risk. We're finding that people are dying, people of different ages are dying from COVID, not just elderly people, not just people with underlying conditions. Of course, people with underlying conditions like asthma, like diabetes, like hypertension are more at risk. Older people, people over 55, 60 are more at risk. Therefore, we don't want that particular population, that particular segment to be exposed. And remember, people of that age do not live in a community by themselves. They live in a community with other people. But having said that, this same COVID, we have found young people also passing away. Now, it's not just death. We're also finding that people are having long-term disability from COVID. They survive it, but then they are left with other things, other effects on them that continues to affect them going forward.
They are no more wearing their face mask. They say, ask you, say, how many people have you seen? Me, I'm not even putting on face mask because we don't believe in it.
In hot season, COVID-19 virus cannot survive. It can only survive at a cold weather. That can happen in countries like America, UK, and other cold. But in a tropical environment, COVID-19 virus cannot survive.
Let them be transparent and let them be sincere.
Pity. The majority of our people still believe, damn, forget that thing, COVID don't go. And so the basic precautionary measures, they are not taking heed to it.
My country people are very, very difficult. Don't listen to instructions. And these instructions are the only thing, the only way out for Nigerians.
The nation needs to be rejected because a situation where some states do believe that they don't have COVID, I think is not right. It's also true that the number of people that have been tested is far from satisfactory. The result we get does not tell us how many people were tested and what the results, and how many people were positive. Because the denominator is the number of people tested. So that we see the positive cases and we will look at the pattern and the trend of COVID-19 in Nigeria. So as far as I'm concerned, we need to do more.
We strengthen our health system, and especially the primary health care. A greater percentage of the population are supposed to benefit from the primary health care. So it is not only the building that we are talking about, we are talking about functional primary health care centers. If all the primary health care centers are functional in terms of availability of care for heart disease, what do we need? Basic things should be available. In terms of personnel, if you agree with me, we have, if I'm right, we have almost about more than 700 health centers in the whole of local governments in the country. If all the 700 local governments have at least a functional primary healthcare center, then this country will move forward. So there will be no threat to any disease that is coming because epidemics come like every 10 years. So we are still going to have another epidemic after COVID.
Please don't lose our guards. Let's continue to demystify COVID-19 and ensure that our people, even in far-flung areas, in rural communities, have enough information to act. So risk communication must be accelerated, must be continued and sustained, And of course, as much as possible, those measures that have yielded results so far should be sustained and improved upon.
This is the time governments, civil society, community leaders, religious leaders have to speak with one voice. I know that it is real because there's so much fake news floating around social media about conspiracy theories, 5G, so many things. People have even been confused.
Grateful for the opportunity of having a vaccine in a few months. It will still take a long time from now till when enough doses are developed and then distributed around the world. I know colleagues are working very hard to achieve that as quickly as possible. But until we get to that stage, we have to work together to sustain the gains that we've made in Nigeria and keep the infection rates as low as possible.
Despite the many challenges that came with the pandemic in the year under review, the entire health sector, and particularly Lagos State, recorded some progress by way of improved service delivery and infrastructure.
We noticed that lots of people are presenting with shortness of breath. They can't breathe properly. And by the time they get to a private hospital or some other place, they will be left outside. They will not have access to oxygen. Some of them get very sick, and before they get to us, they die. So again, this serves two purposes. If you're in this community and you need oxygen, it is a COVID oxygen facility. So nobody is going to drive you away from here. If you are short of breath, they will take you in immediately. At the back, where we have the oxygen bay and all the oxygen cylinders and the oxygen concentrators. Anybody who needs oxygen, who is short of breath, can't breathe properly because of COVID, we will stabilize them here, start the treatment, monitor them. Some of them can go home after that with treatment. Some of them will require to be managed for a few days, in which case we will move them from here to Yaba or any other isolation center where they will continue their care.
Commend the government of Nigeria and most especially commend the government of Lagos State for being very proactive in preventing disastrous consequences of this pandemic.
Coronavirus exposes us to know our weaknesses in service delivery, and so it has enabled all our stakeholders to put the thinking cap on and as well ensure that they put things in accordance. Many of our facilities have been upgraded. What we don't have before as infection prevention control protocol are in place. Many are being trained for capacity building in order to mitigate and lower the curve of this pandemic. So, inadvertently, COVID-19 came as a surprise, but it has helped us to improve on our services and service delivery.
These gains, according to some of the critical stakeholders, must be improved upon for the country to stand firm against the new variant of COVID-19 and other epidemics likely to come in the months and years ahead.
I wish to advise that one of the best things you can do for yourself every Wednesday at 9:30 a.m. is to tune on to AIT and watch the health affair. You will never regret it.
See, Grace, you get one party, birthday party where they share for GD house. Say they come.
Me, I see they care about this corona matter. I no one come. I beg.
But I think say Koro don't disappear for Nigeria now. No, it's still very much around, you know. So I beg, be careful. The opening about the sector of the economy no be excuse to let down your guard. Continue to observe all the basic rules, hygiene rules to stay safe.
Welcome back. Now let's take you to our nutrition segment where we'll be focusing on salt and spices for this edition with Dr. Kingsley Akinroye. It will also form part of our clinic for this edition. To live healthy, good nutrition is one thing you must take seriously this year.
When you prepare food, we advise that you do not add salt to the food, especially when you're at table. And we also say that although it's not measurable, we should eat less than 4 grams of salt per day. A lot of spices contains high salt. Of course, yeah, for you ladies, you're in the kitchen, you know what I mean by that. So you do really should avoid using spices because a lot of them are salted to be able to preserve them for them to last long. Then the type of oil you use is also very important. You should use a vegetable oil that contains less trans fat. You should use a vegetable oil that has been certified, that has been labeled to be heart-friendly. It is also advisable to avoid an environment laden with smoke. Smoking of cigarette is bad. Avoid cigarette smoking and do not live in an environment where they are smoking. And then physical activity is very, very important. You must be physically active. Try to exercise, and the cheapest exercise you can do is walking. Jogging is very good. Playing tennis, playing golf, or playing soccer is also recommendable. So these are the things. These are the risk factors that we know. Of course, weight is also very important. Try to make sure that you are not overweight. All these are the risk factors for heart disease. And of course, because we have said that the number one heart disease we have is high blood pressure. Make sure you know your blood pressure. Check your blood pressure with your doctor, maybe 2 or 3 times in a year. And these days too, there are very cheap instruments you can buy from the pharmacy that you can use to measure your blood pressure at home, because it is always nice. The way you check your wristwatch, the time, once in a month, check your blood pressure. It is advisable as an adult because blood pressure does not just come overnight. It takes time before it manifests in the body, but you only need to check it. Or if you don't want to check it yourself, go to the nearest health clinic that is around you or health center to check your blood pressure. And in addition, you must know your blood sugar. Blood sugar is also very important to the heart, and excess blood sugar is what, when it is in the blood, poisons the blood vessels, because the blood vessels are the ones that are carrying the blood or circulation in the body. And when the blood sugar is too high, we diagnose that as cause what we know as diabetes mellitus. And then so also you need to check your blood sugar with your doctor. And also you can even buy kits at home these days to check your blood sugar yourself to make sure it's not higher. And if any of your blood pressure is high or if your blood sugar is high, please see your doctor or see your nursing or even know your nursing practitioner.
Next on the show is our perception segment.
The thing really about health insurance is that we find out that it's mainly the well-established companies that can actually afford to buy this insurance for their clients or for their staffs. Okay, so we have people. What about the people who are not employed in the corporate environment? What about the market seller? What about the pepper seller? These ones actually should fall under probably the government health insurance. And then we find that a lot of them cannot really subserve the private hospitals. So most of these people who are under the national health insurance scheme have to visit the government hospitals where services are available as well. But then a lot of this health insurance should be done in such a way that encompasses everybody being able to access health, or rather access health care.
This is where we wrap up the show today. Thank you for spending your time with us. My name is Oshomowa Daniels. Please keep staying safe. COVID-19 is real.